Good afternoon and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
It's Medical Monday at East Cooper Medical Center, and today we're hearing from a patient of Dr. Morris Washington, a low-country bariatric surgeon who has changed the lives of those struggling with weight-related health issues.
Prior to surgery, I was extremely unhealthy and was going to see the doctor probably every week from depression, being on medication, pre-diabetes. I wasn't able to do much of anything, play with my son, run around the yard. I was extremely heavy. I had been through many different diets and they all failed. I always gained the weight back. And when I saw on Living Local, Dr. Washington, decided I was gonna just look into it and decided to make an appointment. So I came in and made an appointment, and he actually spent several hours with me that day and explained all of the different surgeries and what my options were. And before I left his office that day, I made my decision as to what surgery I was gonna go with, and definitely had decided I was gonna go with Dr. Washington. Since having the sleeve gastrectomy, I feel absolutely amazing. I'm very confident now, whereas before I was always very self-conscious. In the last 14 months since I had my surgery, I've lost a total of 85 pounds and have reached my goal of 155. I have been able to exercise, walk with no pain. I used to have a lot of pain prior to surgery with anything that I did. Now I can work out with my trainer, I can do jumping jacks, I can do bear crawls, I can do push-ups, I can do anything. One of the biggest things that I always said I wanted to do was a plank, and I could never even think about doing a plank, and now I can do a plank. I can do pretty much everything that my trainer asked me to do, and those are things that I was not able to do before. If I had it to do over again, I would do it all over again. There's not a doubt in my mind that I would not do this again. Definitely would highly recommend Dr. Morris Washington.
Joining us today, we have Dr. Washington, a bariatric surgeon here at East Cooper Medical Center. Thanks for having me today.
Right, thanks for having me.
Okay, so this day and age, we have all these types of myths and misconceptions floating around about weight loss, right?
Right.
And obesity.
Yes.
What are some of the most common ones?
Well, one of the most common ones that I want to, now we know that obesity is a disease. And we used to believe that it was a lack of willpower, a failure of an individual.
Laziness,
right,
things
laziness,
like that.
Right? You just have no willpower. You know, if you watch what you ate and you exercise vigorously, that you wouldn't be in the situation you are now. But we know that that is not true anymore. We know that it is a disease that has, an abnormal set point. And that set point tends to keep your body at the weight that it is. And anytime you try to lose weight through diet and exercise, your body tends to go back to that weight that you're set at.
Okay, so here we're talking about like your stomach stretching after surgery. You get surgery and then your stomach stretches. What's that all about?
Some people, bariatric surgery, first of all, it's not without its weight regain issues, okay? But I would say that in 60 to 70%, it's highly effective for long-term weight loss. When you compare it to diet and exercise, which is 5% successful, it just has so much better outcomes. But patients after surgery can regain weight. Now, is it due to stomach stretching? I think that is a myth.
Okay.
Okay. And I think that most of the time it's because of lack of following the appropriate diets after surgery. We really want people to eat mostly protein, okay, which is meat, fish, cheese, and eggs, okay? We really want them to stay away from carbohydrates, which is bread, pasta, potatoes, rice.
And then probably sugar, which is my favorite. I'm sure they have to stay away from that.
Right. So when bariatric surgery fails, frequently patients are lost to follow-up. They don't attend the support groups. They eat the wrong foods, and that can lead to failures. That's just one reason for it. And then there's a lot of variations in the way the operations are done. Of course, surgeons don't like to admit it, but everything in the body accommodates. So when you make the pouch for a gastric bypass, you have to make it really tiny, okay, because it's going to stretch a little bit. And when you make a sleeve, you got to make it really small because it's going to stretch a little bit, okay? And surgeons, you know, if you make it a little too large and it stretches, yes, it can be a little too big. But I don't think the patient stretches it. I don't think that you should be blaming the patient for stretching it, if you know, because it's going to stretch and you have to make it small in anticipation that it will.
So really, diet and exercise come into play after you get the surgery as far as maintaining the success of it, right? Because we don't want to just say, oh, diet and exercise, they don't work. I mean,
well, it doesn't work in the severely and morbidly obese. I'm talking about people that are well over 100 pounds over their ideal body weight. But once you have the surgery, it's a very important component. And that's why, you know, we have a full-time dietitian in our bariatric program that monitors these patients, and we have to monitor them forever, not just for a certain period of time like a gallbladder. You have your gallbladder operation, and the surgeon sees you the week after, and then he sees you a month after, and everything's good, and he says goodbye. These patients are followed forever. And we really encourage them to attend the support groups, which kind of keeps them in the right mindset to eat the right foods, high protein, veggies, very few carbohydrates, and at least get in maybe 30 minutes of some type of aerobic exercise 3 times a week. And if they do that, bariatric surgery is very, very successful.
okay, so I've heard this before. People say, I just, you know, want to get bariatric surgery and then everything will be fine. Does it actually solve all the problems? I mean, do you wake up and not be a diabetic? I mean,
which is, and that's the amazing part of it. And actually, we now call bariatric surgery metabolic surgery. And our society is called the American Society of Metabolic and Bariatric Surgery. And the reason why we call it metabolic is because bariatric surgery cures many of the metabolic diseases that are associated with obesity. And it's very dramatic that it can cure, you know, close to 80% of type 2 diabetes if we catch it early enough.
okay.
If we can catch it within 10 years of the diagnosis, okay, you almost always get a cure. And the cure of the diabetes usually happens in the first week after surgery, even before you lose weight. So many of the patients that are on tremendous amounts of insulin, okay, I'll do their surgery and I send them home after bariatric surgery on no insulin at all. Okay, it's that dramatic. And, you know, whoever thought that a cure for diabetes would be surgical, but it is.
I would have never thought it would happen that quickly.
Yes, it happens actually. You start to see it in the hospital. Right after the surgery, their blood sugars come, you know, right into normal range.
Okay. Well, is there anything else we need to know before we go? You're new to town, and of course, you have a ton of information, but anything else the folks at home need to know?
Well, I've been doing bariatric surgery for 15 years. It is my passion, and I'm known in the low country area for very compassionate, empathetic, and very low complication bariatric care.
I was just thinking, I was like, you know, he's got the best bedside manner probably ever. Well, thank you so much, Dr. Washington. It was a pleasure to meet you. And for more information, you can head online to eastcoopermedctr.com.